We're focusing on the patient's Bill of Rights, a core topic you will absolutely face on your phlebotomy exam. The exam tests your ability to apply these rights in real-world scenarios. So let's move beyond simple definitions. A key principle is informed consent. The exam won't just ask what it is. It will give you a situation. For example, a patient extends their arm for a blood draw. That's implied consent. But if that patient then asks, "What is this test for?" you must stop and explain the procedure in simple terms. Proceeding without answering is a violation of their right to make an informed decision and a potential exam failure. Another heavily tested area is the right to refuse treatment. A classic exam question involves a patient who initially agrees to a draw, but then says, "I've changed my mind." The only correct action is to respect their decision, stop immediately, document the refusal, and inform the nurse or ordering physician. Exam traps will offer answer choices like trying to persuade the patient or explaining the importance of the test again. While well-intentioned, these are incorrect because they ignore the patient's autonomy. Let's talk about privacy. Under HIPAA, you must protect all patient health information. An exam scenario might describe you seeing a neighbor's lab requisition form. The correct response is to act professionally, ignore it, and continue with your duties. Discussing this information, even with a coworker not involved in that patient's care, is a HIPAA violation and will be the wrong answer on the test. Courteous care and complaint resolution are also fair game. If a patient says, "The last phlebotomist was terrible and left a huge bruise," avoid being defensive or criticizing a colleague. The best exam answer involves acknowledging their concern, reassuring them of your gentle approach, and proceeding professionally. The American Hospital Association's Patient Bill of Rights emphasizes considerate and respectful care, which is a foundational principle. The exam will also test your knowledge of special populations. For patients with limited English proficiency, you must use a qualified medical interpreter or a language line, not a family member, especially a minor. This is a frequent exam trap. For patients with disabilities, the Americans with Disabilities Act, or ADA, requires you to provide reasonable accommodations, like allowing a service animal in the draw station or providing a chair for someone who cannot stand for long periods. To remember these core rights on exam day, use the mnemonic I care. I for informed consent, C for courteous and confidential care, A for accommodations and access, R for the right to refuse, and E for explanation of the procedure. This simple phrase can help you quickly sort through answer choices and select the one that upholds patient rights. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.